Welcome to Tuesday Cafe. I'm Seán Kinane, and we are broadcasting live on November 12th from the studios of WMNF in Tampa. Later on in the show, we're going to hear about sea turtles on Pinellas County beaches and how they were impacted by this year's hurricanes. We'll also hear how Florida is dealing with mosquitoes. So stay tuned for all that. And you can participate during this show by email, dj@wmnf.org. You can text 813-433-0885. You can also call 813-239-9663. And when you text in or call in or email us, why don't you let us know your first name and where you're calling from? That'll be helpful. And you can get in the queue now. First up on this show, we're going to talk about health insurance and how you can find out if you're eligible to enroll in the Obamacare insurance marketplace during open enrollment. It's also called the Affordable Care Act. And open enrollment just started this month. And joining us now to talk about it is Katie Roders Turner, Executive Director of Family Healthcare Foundation. Welcome back to Tuesday Cafe, Katie.
Seán, thanks so much for having me. I'm so glad to be back.
Yeah, I'm really glad you could come on the show and let people know how they can get some help. So let's talk about health insurance in Florida. How big of a problem is the lack of insurance here?
Well, it's pretty huge. Florida has one of the highest rates of uninsurance in the nation. Thankfully, right now is the time to shop for insurance and look for financial assistance and see what people may qualify for. And there's navigators all across Tampa Bay that are ready and waiting to help people shop for insurance.
And we'll find out about how to contact them and all sorts of things during this segment of the program. One of the reasons, or maybe contributing to the large number of people who are uninsured in Florida, is that after the pandemic ended, a lot of people were dropped from the Medicaid rolls. So, are some of them still looking for health insurance?
Yes, absolutely. So over 1.5 million people lost Medicaid after the state of Florida redetermined people's Medicaid coverage. And so many people may still be without health insurance. Thankfully, some may qualify for subsidies on the health insurance marketplace. There may be advanced premium tax credits that they could qualify for that could reduce the cost of their health insurance premiums to less than $10 per month, which is wonderful. Navigators will help people look at those options or even help them reapply for Medicaid if that's going to be the best fit for them. And then there are also safety net programs like Hillsborough County Healthcare Plan that people may also be eligible for. So this is really the right time to look for coverage options.
All right, so we've been talking about the Affordable Care Act marketplace, but remind people what that is, when it was instituted, and what types of products that you can get on the marketplace.
Absolutely. So when the Affordable Care Act was passed in 2010, it also instituted the health insurance marketplace, which is the federal government's one-stop shop to shop for affordable health insurance all in one place. And it opened up in 2013. So we actually just celebrated 11 years of the health insurance marketplace. So right now in Tampa Bay, there's actually 8 carriers in some places and over 160 plans to shop all in one spot. So you go to one website, healthcare.gov, and you can look for health insurance carriers that meet very specific criteria. They have to cover 10 essential benefits. They cannot discriminate based on someone having pre-existing conditions. And then you also can apply for financial assistance. So that's all on healthcare.gov. That's where the health insurance marketplace is. And so that's happening right now during open enrollment.
Yeah, so open enrollment is a time when anyone who wants to try to see if they're eligible for a discount or find out how much it would cost, anyone can kind of sign up and find out about these different health insurance care plans that you said there were 8 different carriers here in the Tampa Bay area, 160 plans or more. So this is during open enrollment. When did that start and when does it end?
Thank you. So November 1st is when it started, and it's going to end on January 15th. And there's some really important dates to remember. So it started November 1st. So we're deep into open enrollment right now. So December 15th is an important date to remember. So December 15th, now that's the day to enroll if you want your coverage to begin by January 1st. So December 15th is important. If you already have a marketplace plan, it's really important to still look at your coverage, fill out your application, make sure you've got the best coverage option, make sure you're still shopping, make sure you've got the best deal. So December 15th, very important. Now, for some reason, if you're not paying attention, if you're focusing on the holidays, it's okay, because January 15th is actually the very last day to apply for coverage to enroll for 2025. And that coverage date would be February 1st start date.
So try to sign up by December 15th if you can, but if you miss that date, you still have until January 15th to get care during open enrollment. Our guest
Exactly.
is Katie Roders Turner, Executive Director of Family Healthcare Foundation. We're talking about the open enrollment period in the Affordable Care Act's health insurance marketplace. This is Tuesday Cafe. I'm Seán Kinane, and we're broadcasting from the studios of WMNF in Tampa. So this is open enrollment, but there are certain life events that will let you sign up for this type of health insurance at any time of the year. What are they?
Oh, awesome. Yes. So if for some reason it's outside of open enrollment, don't worry, because having a baby, getting married, losing coverage. So let's say somebody leaves their job and they've lost their employer-sponsored insurance, or say somebody's retiring early. So we see that a lot. So someone's not yet eligible for Medicare, but they're perhaps retiring early. So that's going to be an option to look at the health insurance marketplace, because you've lost your employer-sponsored insurance. So those are called special enrollment periods, a qualifying life event. So outside of the market, outside of open enrollment, that would be a great time to look at the marketplace as well.
And one big change this year is that DACA recipients are now eligible. What who might be eligible now that wasn't eligible before?
Yeah, so DACA recipients. So this is actually a huge change. So prior to this year, those who had DACA recipients were not eligible to look at the health insurance marketplace, unfortunately. But now this year, effective November 1st, actually, and they can actually begin starting December 1st, have coverage on the health insurance marketplace. So we're pretty excited about this information. And so we'll be able to look at the health insurance marketplace, have health insurance, and possibly have access to financial assistance as well.
Yeah, so you mentioned earlier some deadlines, like sign up by the December 15th in order to have your coverage start January 1st. Is there an advantage to signing up earlier than December 15th? Might you be able to start your coverage earlier?
So I think one of the big advantages of signing up early is that you don't have to worry about it, right? So get it out of the way. You're able to take your time, really be thoughtful about looking at all of your options. Make sure that you're evaluating everything, comparing your plans side by side. You're calling your doctors, making sure that everybody's in network. Now, your coverage will still start effective January 1st. It won't start necessarily any earlier, unless for some reason you've got a special enrollment period that's going to have your coverage begin on December 1st. But if you're just enrolling because of traditional open enrollment, it still would only start January 1st. But we're definitely encouraging everybody to sign up as soon as possible, just to make sure that you're getting it out of the way, you're getting all your ducks in the row, and then you can go ahead and you can enjoy your holiday season and know that your coverage is started as soon as possible.
What if there's someone who already has health insurance, either because they get it through their work or because through a family member that they get it through their work? Would it still make sense to kind of take a look at what some of the options are in the marketplace?
So if you have a spouse or a dependent and you are covering them through your employer sponsored insurance, and it is excessively expensive for you to cover them through your employer sponsored insurance, I would encourage you to look at the health insurance marketplace, because there is a chance that you may be eligible and your family may be eligible, your spouse or your dependents may be eligible for financial assistance to reduce the cost of their coverage on the health insurance marketplace. And that's new. That's new as of 2023. So if it is very expensive for you to cover your spouse or your children slash dependents on your employer sponsored insurance, look at the health insurance marketplace. And navigators at the Family Healthcare Foundation or at our partners like Baycare, Tampa General, we can help you look at that and compare the costs versus employer sponsored versus marketplace, because it may be cheaper to look at the health insurance marketplace, and it might not, but we're always happy to have those conversations with you.
Our guest is Katie Roders Turner, Executive Director of the Family Healthcare Foundation. This is Tuesday Cafe. I'm Seán, and we're broadcasting from WMNF in Tampa. And you've talked about navigators. So, for people who aren't familiar, these are employees who help people walk through the process of finding health insurance. How can people get in touch with a navigator, and what might that experience be like?
Thank you. So navigators are we're funded generously by University of South Florida's College of Public Health, the Children's Board of Hillsborough County Health and Human Services, Florida Healthy Kids, Polk County Healthcare Services, and we're totally free. We have to get federally trained every year. We're experts, and we're always going to provide one-on-one application assistance. And it can be virtual or it can be in person, it can be over the phone. And so basically, we are your friend to talk through health insurance options. And so we will help people fill out applications for health insurance programs. It can be healthcare.gov. It can be Florida Kid Care. It might be a safety net program like Hillsborough County Healthcare Plan or Polk County Healthcare Plan. Whatever is going to help someone get the most affordable or no cost access to healthcare or medical services. We will help people compare plans side by side, understand what's a deductible, what's co-insurance, is your doctor in network. We really want to make sure that you understand what are your medical costs to make sure you're going to get the best deal to help you access medical services. And it can look like whatever you want. So if you just want us to help answer a few questions, or if you want us to set up a 2-hour appointment to go from application through enrollment, that's what we're going to do for you. And it can be sitting in an office or it can be sitting in a Zoom room, whatever's going to be the best fit for somebody.
And you talked about some terms that people who are dealing with insurance, health insurance, are going to come across. So maybe we should talk about what these things mean. What is a deductible? What are some of the other terms that people are going to encounter when they're comparing plans and try to figure out what's best for them?
Yeah, absolutely. So a deductible is going to be what you may have to pay before your health insurance plan is going to contribute to the cost of your medical services. And your out-of-pocket expenses really are going to be very specific to what your respective health insurance plan looks like. Some people may choose to pick a plan that has a low premium. You may then have really high out-of-pocket expenses. Alternatively, someone may choose to have a higher premium, but that may be because they have a more complex medical situation and they want their out-of-pocket expenses to be a lot lower. And so those are conversations that we have with people every single day, all year long as navigators, to really try to find a plan that's going to fit themselves and then their family as best that we possibly can. And sometimes we find that people choose a couple of different programs that are going to fit their family as best as possible. So for example, we've got some people who might choose to have adults on the health insurance marketplace, but then we've got kids and that same family who are going to be on the state of Florida's health insurance called Florida Kid Care. And the best part about being navigators is that we're well versed and trained in all different types of publicly funded programs to best serve a family, to get them into the right program.
And in addition to the programs you just mentioned, Florida Kid Care and the Affordable Care Act, which is a federal service, there's also, had mentioned these a couple of times, but let's talk a little bit more about these options that are the county health departments. For example, in Hillsborough County, how can someone find out whether they might be eligible for their county's health program?
Oh, yeah. So it's really wonderful in Tampa Bay. We've got a couple of really incredible safety net programs or local county-based programs. So in Hillsborough County, there's an amazing program. It's called Hillsborough County Healthcare Plan. And this is a no-cost program for Hillsborough County residents. It's for county residents up to 175% of the federal poverty level. So it's a little over $20,000 for a household size of one in income. We will help people apply for that program, help them get enrolled. It's no cost medical services, emergency room services, primary care, specialty care, no cost services for a whole year. So it's amazing. Pinellas County also has a no cost medical service as well. So that's wonderful. And then Polk County also has a county-based healthcare program too. So if you aren't aware of those healthcare programs and you're a resident of either Hillsborough, Pinellas, or Polk County, navigators at Family Healthcare Foundation would be happy to help you apply for those if you're eligible for them.
And so, if people want to get in touch with a navigator, how can they get in touch with Family Healthcare Foundation navigators? What's the telephone number? What's the website?
Yeah, absolutely. So our phone number is 813-995-7005, and our website is www.familyhealthcarefdn.org. And we are part of a statewide network of navigators. We're part of the statewide Covering Florida Navigator Project. So coveringflorida.org. So there are navigators just like us all around the state of Florida. So we cover Tampa Bay. So Family Healthcare Foundation partners with Baycare, Tampa General Hospital, Evra Health in Pinellas, and Premier Community Healthcare in Pasco and Hernando. So those are our partners in Tampa. And then just like us across the state, Covering Florida navigators are all across 67 counties.
Well, I want to thank you very much for coming on Tuesday Cafe, Katie.
Seán, thank you so much. This is always so wonderful. I so appreciate you.
Yeah, I'm glad that you could bring this information to all of our audience. Katie Roders Turner is Executive Director of Family Healthcare Foundation. And we've been talking about Obamacare, open enrollment, and for the Affordable Care Act, health insurance marketplace. This is Tuesday Cafe. I'm Seán Kinane, and we're broadcasting live from the studios of WMNF Tampa.